Chairperson and members of School Management Council, President QCOBA, Chairman QCPTA, the principal, teachers, honored guests, QCO boys, parents, QC students. Good evening. It was 36 years ago since I attended the speech day of Queen's College as a Form 7 graduate in the year 1976. Throughout the past 36 years, during which I undertook my study in medicine and carved out my own pathway in professional career, I can feel being guided by a set of values firmly established since my secondary school days as a QC boy. Being a public secondary school with students from mostly modest family background, there was a strong sense of self-discipline and responsibility amongst fellow schoolmates. Having worked very hard in order to be admitted into this college, we all knew that we have to work even harder to gain undergraduate placement in local universities. Because overseas placement was not an option for many of us at that time. In this regard, the school has been open and liberal, with no overt pressure exerted for academic achievement and no spoon-feeding. Our teachers adopted a guiding and facilitating role. Yet, with a self-motivating academic atmosphere, performance in public examination had been persistently good. This can be fully testified by the long list of scholars just now. Similarly, QC boys had been allowed to exercise a great deal of freedom, self-initiation, and governance with respect to participation in extracurricular activities, whilst the school adopted an entrusting and enabling attitude. In return, we had demonstrated ability to organize our own administration and learned to be able to manage in a pragmatic way, to accept the responsibility and accountability that comes along with the right of self-govern, as well as to be willing to serve. The inculcation of such values in and the excellent opportunities available to QC boys in the training for management and self-governance in secondary school life undoubtedly had accounted for the making of generations of successful public administrators and political leaders such as Dr. C.H. Leung, Mr. Lim Woon Kwong, Mr. Kong Kei-ji, Professor Joseph Song, and my predecessor, Dr. Yok Chow. The list, of course, not being exhaustive, and is just limited to recent and contemporary development in Hong Kong. They have all demonstrated personal integrity in taking serious accountability of the authority and power vested with them in their respective offices or positions. They have at the same time displayed admirable courage in taking up the formidable challenges facing them without regard to any personal gain or loss, or possible threat to their own personal safety or their professional or political career. I'm most impressed by Mr. K.C. Kwong when he defended the discipline in fiscal management as the Secretary for Treasury of the then British Hong Kong government against fierce criticism by Chinese officials. I'm sure he had chosen what to do, fully realized that this will sacrifice his political career post-1997. Similarly, Dr. C.H. Leung's active participation in the management of the SARS epidemic in the year 2003 and his stepping down subsequently from the position of the chairman of the Hospital Authority in the year 2004, when the authority was criticized by the report of the Legislative Council's Select Committee on SARS, was regarded by many people in Hong Kong as the most honorable and respectable act in a demonstration of political accountability. I'm indeed fortunate and honored to have been associated with and to have the opportunity of learning from many of these QCO boys. So much about personal integrity and accountability. Next, I would like to share with you some other values which I have acquired through my long-standing professional practice and political participation. Again, in the year 2003, Hong Kong was hit by the SARS epidemic. To many of our healthcare professionals, dealing with life or death situation is not anything new to them. However, SARS coronavirus is a novel virus affecting the mankind with very unpredictable behavior in transmissibility and infectivity, as well as varying clinical presentation, thus making it difficult to diagnose and manage in terms of infection control and clinical treatment. As a result, the morbidity and mortality were significant, and the transmission to and amongst healthcare professionals was the most fearsome part. Firstly, transmission to and amongst healthcare professionals brought about a further setback to the already tight workload stress and manpower problem in the public hospital system. Secondly, morbidity and mortality amongst affected healthcare professionals affected their morale, and indeed, in some other nearby countries or places, had caused the mass defaulting of healthcare professionals in neglect of their professional duty and in breach against quarantine regulations. Healthcare professionals in Hong Kong, however, have maintained the highest degree of professionalism and dedication in keeping up with the provision of much needed medical treatment to patients affected by SARS, as well as the continued functioning of the healthcare services for the rest of Hong Kong people. In the course of defending Hong Kong against SARS, 300 healthcare professionals were infected themselves, and 8 of them sacrificed. I'm also honored and proud to be a member of the healthcare professionals of Hong Kong. Up to this date, I paid regular visit to the memorial graveyard in Fanling in respect to these fellow healthcare professionals, and I will continue to do so in the future. On May 12, 2008, another tragedy occurred when Richter scale 8 earthquake hit Sichuan with more than 85,000 fatality and 307,000 injured. Within 3 days of the disaster, that is on May 15, 2012, a team of healthcare professionals from Hong Kong Red Cross Emergency Response Unit reached Beichuan, which is a very severely damaged municipality near Wenchuan. The team was stationed outside the collapsed Beichuan Middle School and helped providing emergency treatment to rescued victims for the next week. During that period, they lived in a tent laid directly over bare muddy earth and experienced continuous rainstorm and hundreds of aftershocks, together with the displaced people from the affected area. Within a week of the earthquake, PRC central government had mobilized all resources for the rescue and search for victims and arranging relief work for the survivors, and speedily transferred and diverted most of the injured civilians to hospitals all over the major cities of the country for definitive treatment, thus relieving the immediate burden of the medical services facility of the affected provinces. However, before long, it was recognized that the nature of the injury suffered by many victims or survivors would require long-term follow-up treatment, surgery, and rehabilitation services. When thousands of victims start returning to their hometown after the definitive treatment elsewhere, this will include amputation and fracture fixation. Sichuan will then be overwhelmed by the huge demand in rehabilitation services. In response to this, the Hong Kong Red Cross set up a prosthetic and rehabilitation center at Deyang city of Sichuan and stationed a strong team of nursing and rehabilitation healthcare professionals at the center to provide continuous rehabilitation services. At the same time, a team of volunteers consisting of orthopedic surgeons, anesthetists, orthopedic and operating theater nurses, and doctors from other relevant specialties visited the center every 2 weeks to conduct joint consultations, ward rounds, and perform surgical operations, such as revision of amputation stump, clearance of infection, revision of fracture fixation, as well as spinal and joint reconstructive surgery. Other rehabilitation services provided at the center included fitting of limb prostheses, physiotherapy, occupational therapy, clinical psychology, social services, etc. From July 2008, this group of volunteer healthcare professionals have provided the much-needed rehabilitation services to over 2,000 victims and conducted more than 300 surgical operations. Their perseverance and dedication over the past years had enabled these victims to stand up again and walk again, to return to their productive working life and return to schools. As you may know, I also left the hospital authority in the year 2005, and recently I'm frequently asked of the reason of joining the 4th term of the Hong Kong Special Administrative Region government after 7 years in private medical practice. Despite steady growth, in the economy since the 1980s and continued development as the leading financial center of the world, Hong Kong lags behind in many areas of social development, and people from the grassroots generally do not and cannot enjoy a fair share of the result of the continued financial growth and economic development. The emergence of the so-called working poor, the appalling living condition of many as reflected by the lengthening waiting list for public housing and phenomenized by the partitioned living units, and the worsening rich-poor gap as reflected by the Gini index, all pointed to the fact that we do not have in place an effective mechanism for the fairer distribution of wealth among Hong Kong people, and perhaps a lack of determination and political willpower to achieve that. In this respect, the fourth-term government of the Hong Kong Special Administrative Region gave its pledge to Hong Kong people that it will and seek to bring in gradual changes to improve the supply of public low-cost housing and private residential housing units, and to stabilize the real estate market so that more people would have access to public housing and more Hong Kong people can afford private as residential housing. We also seek to enhance the working condition and level of remuneration of Hong Kong people, as well as instigating more measures to support the poor. It is with the mission of bringing about overall improvement of social justice to Hong Kong, as well as to seeking to contribute my expertise and perspective in ensuring the continued and sustained development of the dual-track public and private healthcare system in Hong Kong, that I gave up my clinical practice for the second time and joined the government again. It is now slightly less than half a year since the installation of the fourth-term government, and we have faced a number of serious challenges. We will need your understanding and support as well as participation in order to accomplish our mission. It ensured the continued and sustained development of Hong Kong and in effecting changes towards a fairer society for all Hong Kong people. For all graduating and succeeding QC boys, I wish you all success in your academic pursuit and lifelong education, as well as a rewarding professional, management, or entrepreneurial career, and most of all, a fulfilling life experience with your family and the people that you serve. Lastly, I pray that all of us would be able to live up to the values that we share with our forefathers and forerunners amongst all QC boys. Long live Queen's College. Thank you.
Thank you, Dr. Ko.